based on what we know now, what would you recommend for the average frontline clinician? What should he or she watch for, and what, if anything, should they do differently?
So spending more time alone, being suspicious and getting paranoid about things, and of course if they report it, beginning to have perceptual aberrations, and sometimes becoming more hostile, or sometimes just in an intense leave me alone situation. But all these things, of course, can occur in young people, but they are troubling. And if they're causing interference with function and distress, they merit clinical attention. At that point, the real issue would be to try to work with the patient and whoever their important others are in ordinary ways to diminish stress and give support, and how to watch for a worsening in the psychosis, because then you'd want to intervene with other techniques.
Some of the symptoms you just described are characteristics of some of the people I've seen as a forensic psychiatrist. In cases like that, the general public may react and wonder why this illness wasn't caught sooner. What would you tell the public about what families know about this disorder and what to watch for?
Yeah, so of course this is, and we just so frequently are getting the news reports of terrible things happening where there's a presumption that mental illness was involved in it. It's certainly the case that people with a psychotic illness who are not being treated are at increased risk for violence. But remarkable violence is, of course, not common. It's rare. So it gets into the, how do you prevent rare events? So the first thing I would say, and I thought about this when, with some of the college, what colleges do, there's substantial merit in having mental health care provided to troubled young people. And most of that merit is going to be the benefit it can accrue to those individuals, not that you're going to reduce the crime rate substantially. But in doing that, you probably will occasionally have someone who might have gone on to commit a crime that will be less likely to have done so if they're in treatment. Helping patients develop insight, and this is, of course, a very critical issue in schizophrenia, is the poor insight that's part of the brain disorder that they have. It's not just simply denial, that kind of all of us can do about things, but a genuine lack of insight into the nature of the phenomena that they're experiencing. So a lot of reason to think the treatment would be good. How much of a dent it would make in violent crimes that affect other people, that's a more difficult one.